we know we can find lead in our blood. That's after a few weeks, 1% of lead can stay in our blood. And if lead goes into the body at first, you will find 99% of the lead will stay with the erythrocyte. So you will see the lead has effect on the porphyrin metabolism. After the patient exposed to the lead goes inside and stays in the blood. It would attack our porphyrin metabolism system. First, it will attack the delta ALA, decrease the delta ALA in our cells. So you will find the delta ALA increased in our urine test. And lead can also attack CP3 oxidase. So you will find corpuscle porphyrin increased. And at last, lead can attack the hemosynthase. So you will find FEP and ZPP increased in our RBC. So 3 different enzymes were attacked by the lead: delta ALA and CP and hemon. So at last, the patient will have anemia. That is why after lead poisoning, you will find anemia patient. Besides anemia, what's the symptoms of the lead poisoning? This is the third one we have to master. The symptoms, you will find 3 different types. It depends on the concentration of the lead in our body. So the 3 different types, including moderate, severe, and medical emergency. If the lead concentration in children higher than 25 micrograms, it will be moderate. For adults, it should be higher than 60. So the symptoms of lead poisoning are including muscle pains, paresthesia, mild fatigue, aggressiveness, irritability, and lethargy, and abnormal discomfort. If the lead goes with the mouth, you will have abdominal discomfort. So you will see all of these symptoms are mild, not severe. And then if the concentrate increase in the body, for example, the children's concentration from 55 to 70 microgram in the body, you will see all the symptoms get severe than before. The patient will have arthralgia, and the mild fatigue will turn into general fatigue, and nerve systems get more severe. You will see the poor concentration of the children and the tremor. They will have a headache, and the abdominal discomfort will change to the diffuse abdominal pain, and the majority of the patients go to the hospital. Sometimes they have abdominal pain, so they choose to go to the hospital. If they only have the mild fatigue or muscle pains, they will choose to stay at home, but the diffused abdominal pain will let her feel uncomfortable, so they will go to the hospital. And for a severe patient, they will also have constipation and weight loss. These are all severe symptoms. For a medical emergency, we know the lead has two types. This is special one. You will turn the solubility to insolubility, so they were from the inactive to the active one. Then they from inactive one to the active type of the lead. You will have the emergency patient we talked about before. The emergency patient you will find for the children is higher than the 70 microgram in the blood, and for the adults, it will increase higher than the 80 microgram. So just the general fatigue or the muscle pains will change to the paralysis, and the concentration problem will change to the brain problem, and sometimes they will have coma. And for the abdominal pain, you will find the patient with vomiting for the emergency time, and you also can find gingival lead line in the patient and colic. Sometimes it will death. So these symptoms are all belong to the emergency. Let's see the gingival lead line. The gingival lead line, you will see the color is a blue color. This is a symptom of the emergency lead poisoning. It's a clinical sign found in patients with the chronic lead poisoning. It is a very thin black-blue line visible along the margin of the gums. You can go back to check if any gums with the black-blue color. They should be very careful. That will be a chronic lead poisoning. For the diagnosis, the best way to do the diagnosis of the lead poisoning will be blood lead test. For the normal, there are less than 100 microgram. So if it is higher than 100 microgram in the blood lead, you should be careful. That may be the lead poisoning. We also can do the urine lead test, but for the urine lead test, it sometimes is available and it will change, and more useful for the organic lead to do the organic lead diagnosis when we use the urine lead will be better than blood lead. But for a normal patient, the blood lead test is the best way to do the diagnosis of the test. And of course, after the lab examination, we also should have the symptoms of the patient. And we also can do the ZPP and the EP test to do the diagnosis, because you see, before we knew the lead has effect on the porphyrin metabolism, so we can do the FEP and the ZPP test to measure lead in our body. And beside the diagnosis, how to do the treatments for the lead poisoning, we knew the symptoms, the emergency or the severe symptoms of the lead poisoning can take the patient to death. So when we do the treatment for the patient, we should be very careful. And for the treatment for the lead poisoning, we should know always prevention first. So this is preventive medicine, so we focus on how to do the preventive. For the lead poisoning, if we find the lead in the industry, we have to move the lead from industry or lower the concentration of the lead in the industry. If we have the patient, how to do the treatments, the EDTA is the first choice for the patient. And besides the medicine, we should give the patient more treatment, including the symptomatic treatment. When they have a colic or stomach pain or abdominal pain, we have to move the pain for a patient, so we can do the symptomatic treatment. And after the treatment, we also should give the patient more life support. What is EDTA? The EDTA is sodium calcium edetate. How to give the patient EDTA? How to do the treatment? The EDTA can give the patient, you can't continue to give it to the patient. We have to do it once a day for 3 or 4 days. Once a day for 3 or 4 days. After that, let the patient have a rest for 3 or 4 days without any drugs, without EDTA. After the rest of 3 or 4 days, then we give another round of the EDTA for the patient. That is because the EDTA can also take the cadmium away from the patient. So we want to balance the cadmium in the patient body. We also want to take the lead away from the patient. So when we use the EDTA, you should remember once a day for 3 or 4 days. Then let the patient have a rest for 3 or 4 days without EDTA. Then give the patient another EDTA again. So for the childhood lead poisoning by the FDA, they think DMSA is the best choice for the treatment. So for the treatment for the childhood lead poisoning, we can choose DMSA. And the other symptoms, when the patient have the lead colic, we can use atropine to release the pain. Why we use the atropine, not other? Because of the lead colic make the smooth muscle spasm. This smooth muscle spasm can relieve by the atropine. So we choose atropine to be the treatment for the lead colic patient. And for the neurotic symptoms, we know some of the patients will have the headache problem or the brain problem or the nerve system problem. So we can use a sedative to relieve the pain from the patient. So EDTA is the main treatment for the patient, or for the childhood lead poisoning, we can use DMSA, and we also can use atropine to do the lead to relieve the lead colic, and the sedative for the neurotic symptoms. For the life support, we can tell the patient after the treatment, after you go back home, take a rest and have more adequate nutrition. That because we know the cadmium is very good for the patient when the patient has lead poisoning. So adequate nutrition should including the food with the higher cadmium. So let's do the conclusion. First one, where we can find the lead, the sources of the lead. You can find the lead as occupational exposure, the industry, we talked about that before, including the mining, including the batteries, and also including the pigment, for example, painting. And we also can find lead exposure in the household exposure. For example, for the children, the very shining toy with colorful painting, that may be a poisoning for the children because of lead. So the second one, we introduce the toxicity of lead poisoning. The toxicity of lead poisoning including multiple organ damage, because lead can stay in the liver, kidneys, lungs, so it will have effect on the different organs. And quite a long time, the lead will stay in our bones, hair, and teeth. So you will find lead line in our teeth and the bones problem. So that is multiple organ damage. It also can stay in our blood with our red cells. So you will infect on the porphyrin metabolism. So that is the toxicity of the lead poisoning. And what's the symptoms of the patient of lead poisoning? You will find 3 different levels. That's moderate, severe, and emergency. You have different symptoms of these 3 different types. And what should we do for the patient? EDTA is the main drugs to do the treatments for the patient. We also should give the patient with symptomatic treatment and life support. That is conclusion and inclusion of lead poisoning.